9 days in Florida from a pregnancy-related complication, and Black Floridians are dying at higher rates than white or Hispanic women. As News Channel 7's Jake Stofan tells us, lawmakers today heard what the state can do to combat the disparity.
House Speaker Chris Sprowls made this comment during his speech at the organizational session in November.
Recently, I've been looking at the data of the disparities that Black women face in maternal health care.
Now, a House committee is looking into the issue. Lawmakers were told on average 40 Floridians die each year from pregnancy-related medical issues. Almost 70% are considered preventable.
Even more tragic is the number of children who are left behind.
The state has made some progress at closing racial disparities in death rates between Black and white mothers. Previously, a Black mother was 3 times as likely to die from pregnancy. Over the past 5 years, the disparity has been cut by a third, which is good news to Committee Chair William Robinson.
I wanted at least the members to understand the data to make sure moving forward we continue to see that decrease over time.
But Representative Eskamani says the state can do better.
The rates for women of color are disproportionately high compared to white women. And so that is not something to celebrate.
Democrats on the committee want to see the state implement racial bias training in hospitals and expand Medicaid to decrease mortality rates.
There's been efforts to expand that access, to better understand the racial implicit bias within the medical field. And none of those bills have ever gone to hearing.
But Robinson was non-committal on legislative action.
Will there be some policy initiatives based upon that data? We'll have to wait and see.
Overall, the state has seen about a 30% decrease in pregnancy-related mortality rates since 2009. Reporting from the state capitol, Jake Stofan, News Channel 7.
Now, of the pregnancy-related deaths, hemorrhage was the leading cause. Experts told lawmakers C-sections increase the risk of hemorrhaging. Florida's C-section rate is 30% compared to the national target of just under 24%.